The idea of the integrated discharge team is to be involved with any aspect of discharge planning that isn't straightforward.
Which aims to improve the transition between an acute hospital stay and patients returning to the community.
Within the integrated discharge team, we have members from all disciplines: physiotherapists, occupational therapists, community care officers, social workers, nurses.
We all work together so that we can make sure that all the patient's needs are met, so that we can be confident that the patient's going to go home safely.
In other trusts, if they're not working in an integrated way, it means that people are still working in silos, and the big problem with that is lack of communication.
The challenge is overcoming those initial difficulties, staff starting to understand the different pressures that colleagues were working under, starting to experience the different assessment processes that they were trying to apply, and coming together and recognising that and developing that kind of joint approach and that joint way of thinking.
At first, some of the challenges were within different ways of working really, different cultures, different systems that we had to get used to, and also people wanting to retain ownership of cases. That took some time. We've done so well. They truly are an integrated team. The problems are shared as well as the successes.
I really think that the IDT has instilled a different mindset or a different culture into discharge planning so that we reduce the length of stay for patients.
This way works so much better. We are brilliant together, in all honesty.
Everybody's together. You all share an office, so you are communicating not only on a daily basis, but sometimes on an hourly basis.
We've got respect for one another and understand the skills that we all bring to the team.
I also think because you've got that on-hand knowledge on a daily basis, patients, their destination tends to be the right destination.
It benefits the patient because they're able to get a holistic assessment.
They don't have repeated people coming to see them. They're seen by one person. All the information is very clear to both that patient and their family.
It's reducing the length of stay of patients in hospital, which is reducing the delays.
They're at much lower risk of getting hospital-acquired infections.
Patients generally tell us all the time that they want to go home.
We would hope that this would make them less institutionalised, and also so that once they get home, they're more able to return to a normal level of function. I think as well, patients are happier at home. They would much rather be at home with a bit of support than be in a hospital where they're having to have things done for them. They want that independence and they want to manage at home for as long as they possibly can.
I've been very pleased at the way that the staff have talked to me and explained everything there is to be known about my problem. I was also shown by the physio that I could have this other frame for walking with, and that were perfect. The occupational therapist suggested that I should have a perching stool, and that's worked out perfect. I was shown how to use it, and then of course a social worker offered me support at home. So I think that would be ideal, and I would certainly recommend it.
I'm Claire Warren, I'm the Registered Manager of Positive Step, the Social Care Assessment Unit. Dorothy was a patient in DRI, and once the ward would have identified that she was over the acute stage of her illness, it would have been identified that she were suitable to come to Positive Step. Over the first 2 weeks, Dorothy's appetite was very poor, mobility was unsteady, breathing wasn't really very good, and she lacked a lot of confidence. We are now on week 4. Dorothy is due to be discharged after working with the multidisciplinary team. They've identified some care needs that she needs on discharge, but she's all ready to go.
It's really helped me. I would never have got so far without her. Every week walking there because I could hardly walk when I come here.
She's just been such a success story. She's blossomed in herself, in her appetite, her mobility and her confidence, and she's wanting to go home.
What we're really proud of as a trust is that we've got one of the lowest delayed transfers to care rates in the country. It's that merging of boundaries and merging of roles which makes them very different.
Nationally, we're now being recognised and people want to come and see how our model works. Having social care assessment beds, having different pathways out, having the wards referring cases into community services directly is a recognition of the partners within what we've termed Team Doncaster. It's just an innovative way that we've dealt with a really difficult situation.
They're providing tomorrow's services today.
The team have worked extremely hard to become a team of professionals that are recognised nationally and locally as an area of good practice.
We all come to work with a shared common goal, and that goal is to help these patients get home and be happy as soon as possible.